A 67-year-old female with symptomatic ward-off necrosis was referred for EUS-guided transmural drainage. 2 discrete collections were visible on CT. Decision was made to drain both collections adopting the multiple transluminal gateway technique using 15mm diameter dual-flanged lumen-opposing metal stents with electrocautery enhanced delivery system. The ward-off necrosis adjacent to the duodenum was first accessed using electrocautery. After positioning the catheter within the ward-off necrosis, the stent deployment hub was released to deploy the distal flange of the stent. This was followed by deployment of the proximal flange within the duodenal lumen. The echoendoscope was then withdrawn into the stomach and the perigastric collection was drained using the same technique. After stent placement, the cavity of the ward-off necrosis was irrigated using normal saline mixed with gentamicin. The patient then returned 8 weeks post-procedure for routine follow-up. ERCP was first attempted to assess the patency of the pancreatic duct. On contrast injection, the contrast flowed into the ward-off necrosis and through the stent, concerning for disconnected pancreatic duct. Due to the presence of disconnected pancreatic duct, we attempted to access the ward-off necrosis to exchange the metal stent for plastic stent. However, this attempt was not successful. The transgastric metal stent was then examined. However, the distal flange of the metal stent had migrated into the soft tissue in the lesser sac, and it was not possible to access the residual ward-off necrosis. An EUS examination was then performed, which confirmed the presence of the disconnected pancreatic duct. Both metal stents were subsequently removed.